Hi, everyone. My name is Dr. Alisa Kauffman, and I'm a geriatric house call dentist in New York City. We've created this show called Caring and Able to help showcase the very best resources for caregivers and the elderly. You'll find services and products that will fulfill all of your needs. Services like medical, dental, podiatry, and even florists. Products that are tried and tested, such as walkers that'll assist you in getting out of your chair. We talk about ableism as opposed to disabilities. With our help of the list of people that we're going to recommend, you can make educated guesses and choices and not just rely on Google or Yelp reviews, which we all know are not always so accurate. Today's guest is one of my favorite people. Her name is Dr. Joy Poskozim. Did I say that right?
Beautiful.
Good.
Perfect.
Yay, I practice. And she joined Geriatric House Call Dentistry this summer. She services the Chicago area. Dr. Joy, as she is affectionately known, probably because half of her patients will mispronounce her last name,
Absolutely.
has been seeing, is that right?
Yeah.
Has been seeing patients at home for more than 10 years. She's a 1994 graduate of NYU, yay, New York, and completed her GPR at Woodhull Medical Center, where she was awarded Resident of the Year. That's amazing. She's a fellow of the Special Care and Dentistry Association, the Geriatric Council. She's a member of the ADA, Academy of General Dentistry, Illinois Dental Association, and the Gerontology Society of America. So welcome, Dr. Joy.
Thank you. But I must admit, I graduated in 99 from NYU.
99.
99, yes.
I made you 5
like
years older. Wow, you're a youngin'. I could have been your mom.
But you know, it's so funny. Like, we were so excited our first year when we graduated. But we're graduating in 1999. You know, the Prince song. We're gonna party like it's 1999. And by the time 1999 hit, we're like, we're done. We're good. Thanks so much.
That's so funny. That's so funny.
We were happy. We were happy.
I guess the first question I want to ask you is, how did you get into house call dentistry?
Great question. So it was never even a concept when I was in dental school or even in residency. It came as a need for my grandmother. Needed a new lower partial denture, had horrible sciatica going down her right leg, and she had a very difficult time maneuvering. Wonderful children, countless grandchildren, eager and willing to help her. But, you know, it was really tough. So fortunately, she was 10 minutes from my office. So I was able to go to her and make her a lower partial denture on the spot. So the one place that she would go to was church. She went to church with her new lower partial denture. She was showing everybody at her women's guild at the end of Mass. And I got a phone call the next day asking if I could do the same thing for a grandmother and a fellow parishioner who was a stroke victim and was bedbound, but they noticed this smell coming from her mouth and they didn't know what was going on. Could I assist? And this became my career trajectory did a sharp right turn. I couldn't imagine doing anything else for the people that need us the most. It was something that never even crossed my mind, and yet here is this this population of people that truly need dental care, and without the ability to come to us, and so it became a huge part of my practice.
Wow, so that's ableism. That's a great example of ableism. You are able to help people who are underserved. That's what's really needed. This is the most necessary generation of the population that needs services at home. They have a vital life. They just might not be able to get out. And I mean, COVID's really proven that. So what are the top issues that the caregivers or the families call on you for?
bad breath, dry mouth. They are noticing a film on their teeth, and it's making their teeth yellower, and they don't understand why. Or maybe they've lost some weight, and now their denture or partial denture doesn't fit anymore, and they wonder what they can do about it.
So you're able to go into the homes and solve these issues, but like, since we both do the same exact thing, do you actually interview them on the phone so you know what instruments to bring or products to bring? So I mean, how many times have you gotten there and I'm sure you've already gone through this, where they say, could you please re-cement the crown? And you get there and the crown is now broken off. The root is there and you need to extract the tooth because there's nothing to cement on. So do you actually ask to send a picture like I do? Show me the inside of the crown, the outside of the crown, and the stub left in the mouth?
It's amazing that, you're in New York and I'm in Chicago, and yet we have experienced the same things and have gotten to the point where we are asking the same questions. So teledentistry has been a part of my practice for the last 9 years. The first year, you live and learn, right? Mistakes are made.
Absolutely.
And so, before even COVID, teledentistry was a huge thing for us. Pictures are being taken, they're being emailed to us, they're being now, with modern technology, with our phones, they're being sent by our phones. And yes, we are absolutely, we do a ton of triage. We do a lot of conversation, a lot of information sharing between either the patient themselves, and if they're not capable, then the loved one, the POA, the powers of attorney. And if they are working with hospice, then the hospice providers, the hospice agencies. There is a lot of communication that is a lot of information that is generated prior to me seeing them, because I want to make sure this appointment is as useful and as productive as possible, so that we can accomplish a lot for them during that time.
Let's talk a little about hospice, even though it's not a topic that anybody really wants to think about or talk about. But how do you think we could get our names out to people so that they know, for the hospice workers, for the hospice caregivers, that we're here? Sometimes they feel like there's nothing they can do. The patient's in the bed, they're swollen. I mean, what do you think that we could do besides, sending out shows like this to the general public for people to find us? I mean, you're in Chicago, a big metropolitan area, and I'm in New York. People are lucky that they have people like us. But what about in the Midwest? What about in little places all across the US? Besides hospice, how do you think that we could get house call dentistry into the hands of other dentists? So that's two questions.
Yeah, no, I completely understand. So first off, with hospice, education from the beginning with every hospice agency out there, that they have to understand that once a patient has been put into hospice, that does not mean that their oral care has to suffer. It is like a light is switched off with the toothbrush, and the light has been switched on for those swabs. They still have teeth. Teeth can still be brushed. They need to be brushed. They need to be brushed twice a day. They need to be brushed 2 minutes twice a day. And the concept that the oral care should be completely turned off is beyond. I just don't understand how that is even thought of as a possibility. So education at the agency level is key. With other dentists, it really has to come, I believe, from the schools would be wonderful. I do know that NYU now has a 1-week rotation working with nursing homes. And so that is absolutely wonderful. I hope more schools are doing that. I know the University of Iowa has a fantastic gerontology program. And so it really has to be, unfortunately, kind of an ad hoc thing where there has to be interest that is generated amongst the faculty and have that passion shown to their students. For dentists that are already practicing, it starts with asking questions. Do you have a loved one who lives at home with you? Do you have a loved one that lives in a nursing home? Do you know if their oral care is being properly provided for? Generating curiosity, generating questions, generating the education for the patients that we have. I mean, I do have my own brick and mortar, and this is a question that I ask every new patient.
Nice.
Do you have a loved one that lives in a home? Once a day, at least once a day, that we have that. And so then now I'm not just talking about their health, I'm talking about their loved one's health as well, and having that conversation. That is easy. That can be done at the hygiene level, that could be done at the dentist level, that could be done with the dental assisting level. Generating that curiosity, generating that information is so important. And I think it really would be astounding to the dentists that do start asking these questions to find out that, that oral care is not part of ADLs, it's not part of activities of daily living, that no, their mouths, their loved ones' mouths are not necessarily being brushed twice a day. There has to be a level of advocacy regarding this as well. Yeah.
Well, I mean, you have to admit, I mean, I don't know about you, but I will say that maybe 1% of all of my referrals come from dentists. What is it with other dentists? It's terrible. All of my referrals come from either hospice nurses or nurses in general, visiting nurses of New York, visiting doctors programs, or just even geriatric care managers. Dentists who know about me are not referring to me. And I think it's maybe just a selfishness within our, unfortunately, our community of dentists. It's so strange. So we are really trying to get the word out with geriatric house call dentistry. I mean, you have your own practice. I don't. I do it this full time. So, you do a lot more than I do, and you find time to do all the house call dentists. What do you think? So in New York, there's a few people that do what I do. I know in Chicago, there's a few geriatric house call services. What do you think separates you from the other house call dentists in Chicago? Because people will be watching this show on our website, and it'll be on both of our pages. So what highlights Joy, Dr. Joy, to separate you from Dr. Smith and Jones in Chicago?
Correct. And that's a really good question. I will go literally everywhere. That has been a big thing for us. It is not unlike me to drive. In fact, next week I'll be driving an hour one way to get to someone that's living, in far outside the city.
So nice.
They are equally important as someone that is walking distance to me. So that's number one. Number two, I really try to do as much as possible with cutting edge technology, meaning I am a big believer in using products like silver diamine fluoride, which is a wonderful way to arrest decay. I'm a big believer in making sure that every patient has a fluoride treatment, regardless of what their mouths look like. And I'm also a huge believer in education. I will spend, at least a half hour, 45 minutes treating the patient, but I'll spend the next half hour also discussing, okay, here's where we are. This is where I'd like to see your loved one to be. And this is what is going to, what is needed, what is required to get to that point. Who else can I talk to that is treating your loved one so we can have that conversation? Because there's a lot of information that is being given out. And I do, write things down for them. I personalize it. One treatment is not the same for everybody. But I also want to make sure that if someone does have a caregiver and they have round-the-clock care, that the person I talk to at 2 o'clock is going to be different than the person I talk to at 4 o'clock or at 9 o'clock at night. So making sure that I know those people's names, making sure that I know that I can communicate with them and say, okay, well now, it's 9 o'clock. I know they go to bed at 9:30. Let's make sure, yes, I understand that she's sundowning. She's not the same person as she is at 8 o'clock in the morning. Here's what you can try to do to make it easier to get that second brushing teeth in. Maybe it's in front of their TV, and their Jennifer convertible, easy chair dentistry. We can work. I tried very hard to work with not just the patient, but also everyone involved to make sure that they are getting the proper treatment that they deserve, and something that I also try to make it as easy as possible.
Do you accept any insurance plans?
Great question. So if they do have dental insurance plans, I will work within that dental plan as much as possible. I think what people also have to understand, though, it's a coverage. It's not necessarily going to, unlike medical insurance or Medicare, where the majority of procedures are covered. Unfortunately, dental coverage is not like that. So we do have that discussion ahead of time too, that, this is what is going to be involved. This is what I need to do to come to your home. And this is the, treatment that I'm going to have to be performing. And we can go over what the insurance will pay for and not pay for. But unfortunately, and in Illinois too, there is no dental for Medicaid. So, for adults. Children, yes, but adults, no. So we have to have that conversation as well.
Right. Medicare, I don't know in your area, but Medicare commercials in New York City say that some cover dental.
Yeah.
And I know for a fact that they may cover dental, but it might be if you're having like a kidney transplant or something that's really necessary that they have to cover everything. So I'm hoping that in the future that Medicare will cover dental, and then new dentists, like right out of their residency, or retiring dentists who are leaving their practice will want to continue having an income stream. And so they will sign on to be Medicare providers, and they will pay decent money. I mean, we're going to the homes. We are schlepping equipment. I don't know if you saw this. This is a new product that Septidont just created.
Oh yeah, I saw that.
Which is, a disposable, refillable, so you could use this on one patient, and then the needle is protected and you throw it away. It's not great for our carbon footprint, but there are companies that are thinking of disposable products that are great for people like us, because when we go into the home, it's nice to open sterilizable packs and to bring instruments that we used once and toss. So, it's not an easy thing to be a house call dentist, but it certainly is rewarding for us. I mean, we are really, talking about caring and able, we are really caring for people who would not be able to get anything. I mean, how many times have you taken out a tooth on a swollen patient who's laying there in pain, and, they have to go to the hospital in an ambulance, and then they have to find a resident, and it's just not fair that, people cannot be treated in their homes the same way they can be treated in an office. And obviously, and we're not even discussing, you can't do root canals, and you can't do large crown and bridge cases, and you can't always re-cement a crown, but we're able to help. We're able to really help people live a better quality of life. I mean, let's face it, you're older. The only thing you can do is eat, smile, speak, right? And chew effectively. And if you can't do one of those things, your quality of life is really diminished. Would you agree?
Oh, absolutely. And there's a huge difference between New York hospitals and Chicagoland and Illinois hospitals. There are only 2 hospitals in that are not affiliated with the dental schools that have any dental residents. 2. The rest of them do not. They might have an oral surgeon on call. So if that's the case, then now, they've gone to OR or ER, and now they have to call, the oral surgeon, and hopefully the oral surgeon can come in and take a look and do what is necessary in the hospital setting. So the dental resources in a hospital situation in Illinois is far more scarce than what you see on the Eastern Seaboard. Where there's a residency program pretty much per hospital. It is the way it is in most of the country. It's unfortunate. But if we can put the word out that there are dentists like us that, like you were saying, caring and able, to perform the same treatment in the comfort of their own homes. It's safe, it's effective, and unfortunately, a lot of times necessary in order to make sure that they're being provided with the proper oral care to get them out of infection, to get them out of pain, and to get them on a better path to oral health.
I guess there's a lot of dentists that are just afraid, maybe with their own skill set, to go in the home and take out a tooth. I mean, there isn't adequate suction, the backup is 911 for the most part. I think that we really have to have a lot of guts to do this, but I also think that there's a lot of glory involved. And, there are times that I'm sure that you look at a tooth and say, no, I can't do this in the home, because we don't get ourselves into trouble. And
Absolutely.
That's very important for people who are listening to this conversation to understand that we don't just do it for the sake of doing it. If we don't think 100% that we are going to be successful, we will take you to the oral surgeon's office or refer you to someone else and put you on an antibiotic in the meantime so that the infection subsides. But we want everyone to know that what we are doing as a group, Geriatric House Call Dentistry, and we would love to expand this so that everyone across the country has access to care like you get from Dr. Joy or from myself. But to know that we are doing safe procedures in the home, and only the ones that we're 100% competent in doing. There's plenty of things that we say no to.
Absolutely. And also for those that are on blood thinners, I always have a conversation with the medical doctor, the medical team, because it's it's between myself and the medical team to decide whether or not that person needs to be taken off their blood thinners, if the patient is medically competent to have extractions. And if they are, is it one at a time? Is it can we take out multiple teeth at a time? And so on and so forth. So there's not just communication between.
We lost you. We lost your
to make sure that they're safe and sound. Did you get me?
I think we lost that last sentence. So just start from here.
Yeah. So it's that communication with the medical team that is so important as well, to make sure that we are providing them the proper care.
Right.
If the medical team that they feel that they are not medically competent to be able to have certain treatment, then that's that's the path that we have to go down.
Well, I just think we had a great talk today, and if you want to know more about Dr. Joy Poskozim, please look at geriatrichousecalldentistry.com, and you can click on her page, or you can Google her and find her office if you want to go see her in her brick and mortar office. And it's been delightful to actually spend some time with you. We don't spend enough time together.
I know. This is incredible. I'm so glad that we're able to do this today. Thank you so much. I think the questions that you asked were fantastic, and I hope that this little time that we had together provides some resources for the ones out there that have a loved one that needs oral care.
Thank you so much.
You're welcome. Thank you.